Election-related matters, half a dozen newly born babies and mothers have died in the last 6 years at an island community of Faana in the South Municipal Assembly of the Greater Accra region. That's according to residents there. The community is trapped in between the sea and the lagoon with no access to health care. Other persons living there and pregnant women continue to die and deliver in canoes as a result of traveling for over 1 hour in paddled canoes to access health care. Henry Kwesibidu returned from the community. Here's his report.
35-year-old Kwame recounting how her wife in 2018 delivered their first child in a canoe en route a chief's compound miles away from the island community.
I went fishing when my wife was in labor. She delivered on her way to the hospital in a canoe. The hospital is very far from where we live. I was afraid something might happen to my wife because the health center was a distance away.
His wife is lucky to have survived, but the fisherman is worried because his wife is now 7 months pregnant, expecting a second child soon.
I am now afraid that something may happen to my wife the next time she labors.
The only way to access the community is by canoe. With no electricity, water, and other basic amenities, pregnant women and other members of the community in dire need of health care will have to risk their lives by sitting in paddling canoes without life jackets for close to 1 hour to reach the nearest health facility.
There is no clinic here. There is no anything that can help an individual or people here so that they will be able to give birth. That is why normally when they are in a labor, people normally convey them in a boat to Chokome or the other side, that is Pamblos, before they can do deliver.
Rosemary Dasi is also a resident here. Her water broke in the dead of the night last year. With no canoes operating in the night and no traditional birth attendants, she had to wait for 4 hours to get a canoe, enduring severe pains and putting her life and the baby on the edge.
It
started around 1 a.m. I felt funny, and my husband called his mother and grandmother. They confirmed my time was due. The canoe came around 5 a.m.
Rosemary delivered, but she does not want to relive the same experience.
I was in pain and I couldn't sit in the canoe. After an hour, we got to the banks of the river and I was told to quicken my steps. I got to the hospital and delivered safely, but it was a horrifying experience.
Pregnant women aren't the only victims here. Other sick persons face similar challenges too. They rely on first aid until they get access to canoes, which are not readily available. Rosemary now has 2 children. She tells me how she takes care of them anytime they are unwell before seeking medical attention.
I take my children through steam inhalation or give them some herbs anytime they are unwell until I get a canoe.
Health personnel visit the community occasionally to provide life-saving health services like immunizing their babies.
Henry Kwesibidu's report read to you there. Joining us for the conversation is Dr. Abna Okon. She's the director of South Municipal Health Directorate. Thank you so much for joining us. This community right here in the Greater Accra region, doesn't even have a CHIPS compound, a clinic. They are an island. Doesn't this make them a high priority area?
Faana is an island community, as you said, under Botiano sub-municipal. Currently, they do not have a CHIP compound there, yes, but we do offer life-saving services to them. Our community health nurses go there twice in a month to give them vaccinations against the 13 childhood killer diseases. And also, we have a functional CHIP zone at Chokome. Chokome is an hour away from Faana when you are using boats. So when we pick the pregnant women in the community, they are then referred to the functional CHIP zone at Chokome. But in Faana itself, the community health nurses go there and offer them the services that they require, which is the immunization services.
Doc, a pregnant woman, I mean, labor can be quite unpredictable, as we've heard. The stories of many women, putting a woman in a boat in that condition, in that pain, the possibility of complications alone. Why don't we have a health facility in the community as we speak?
Okay, all right. So what you are talking about is a multi-sectorial issue that needs to be solved, okay? So a CHIP compound or a clinic, it has to be built together with the assembly, with the government in the community. Do you understand? So it's not there. It would be ideal. It would be ideal and best if we had a clinic or we had a CHIP compound on the community, and that would have made access much easier. Currently, the closest facilities to Faana is the Botiano Polyclinic and the Chokome Functional CHIP Zone. Okay. These are the closest they have. It would have been great to have a clinic there, yes, which we would have offered services to the community if the clinic was there. If the clinic is there, we would have put our staff there and they will offer all the services that they require, especially to the pregnant women. As you said, it wouldn't be ideal to have them in the boat to cross over the Densu River for an hour before they get to Chokome or before they get to Botiano Polyclinic. But within the circumstances, we are doing the best that we can by going to them to give them the services and then also referring the pregnant women that we come across to our closest center, which is the Chokome CHIP zone.
Doc, I understand that you're doing what you can at the moment, but as a stakeholder, have you in any way reached out to the assembly, government, as you say? I know that the health directorate, the health ministry works directly in conjunction with government. Have you reached out to government to say, look, this is a community, they are an island, they should be treated as priority, at least to get a clinic? Has that been done at all? Has there been any meeting? Has there been any letter written in regards to getting this community a health facility?
Yes, there's been several communication going back between Assembly and the Health Directorate, as well as with the national level. We've written for support. We've also written for support like boats to even make it easier for health staff to even go there more often. We are still in communications with the Assembly so that a compound in the near future can be built. So these communications are still ongoing.
All right, briefly, Doc, you said that you send two community health nurses go there twice every month to take care of children, especially give them life-saving vaccination. So what happens to other people who report with other conditions or ailments? All
right, so the community health nurses, what they do is that they give you first aid. So after the first aid, if the issue you come with is beyond what they can do, they will refer you to the closest facility, which is Chokome CHIP Zone or Botiano Health Center. What they do is giving you the first aid or the counseling, the first things you can do to prevent any fatality.
All right. Thank you very much for your time this morning. Dr. Abna Oko is the director of the Gas South Municipal Health Directorate, speaking to us about Faana in the Gas South area where there's no health facility, unfortunately. Thank you for your time this morning once again, madam.